facilities like this one, the Addiction Care Center, I'm going to tell one little story. I was in Buffalo, and a big guy came over to me, and he was muscular and big, and he had all these tattoos on his arm. He was wearing a really tight shirt. But he came over to me, and he just started to cry. And he told me his story. His son had volunteered and served in Iraq, got PTSD. When his son came back to the United States, of course, as many on PTSD do, he fell prey to opioids. And for those of us, and I have known people who are plagued by addiction, you know it here, that it's often hard to have people get help until they sort of hit bottom. So it took a while for his son to hit bottom, but then he said, "Dad, I'm willing to go to help." His father went to all the centers in Western New York. The quickest one had a 23-week waiting list, and in week 22 his son killed himself. That's the kind of story you hear that just dramatizes the need for what we are doing. So, first, I am calling on a historic $3.2 billion increase in funding for the National Drug Control Program agencies in the upcoming budget. I fought hard to get an increase to combat the opioid crisis in the American Rescue Plan. We got $1.5 billion for Community Mental Health Block Grant and $1.5 billion for the Substance Abuse Treatment Block Grant, which are sent to organizations like the Addiction Care Center. But the crisis isn't over, as anyone who works here can tell you. And while I'm just looking at you, I want to thank you for the good, hard work you do. You are just helping people, our most resource. You should give yourselves a round of applause. Of course, the cold-hearted press doesn't clap. No, it's a joke. They're not allowed to. They're not supposed to show sides on any of these things. Okay. So it's a crisis, and we have to be treating it as such and get the people right on the front lines, like the people here, the help they need. So the over $3 billion increase means more funding for evidence-based prevention. They know what works. When people come here, their record of solving the problem, not solving, but ameliorating the problem so the person can go back and live a productive and often very happy life is high. But there just aren't enough resources here. Aren't enough resources. So the money would go into prevention, evidence-based prevention, additional treatment options, harm reduction, recovery support services, and targeted investments. I've already spoken to the White House about my intentions. But they know Congress has the purse. And you know I am the majority leader, first ever from New York in the United States Senate. And so I have a pretty good record when I want to get something done to get it done, as we've seen in many things that have happened here in the Capital Region over the last little while. And so I am going to make this a very high priority. But I'm not stopping there. Combating the opioid crisis must also support those battling with substance abuse, but also cut off the supply and stop dangerous drug traffickers who put the fentanyl on our streets, harming the most vulnerable. So second, and despite this epidemic, two of the largest regions which have seen two of the counties, the largest counties here in the Capital Region, which have seen a big wave of overdose, do not have something called HIDTA, high-intensity drug trafficking areas. This is where the federal government coordinates with local law enforcement to prevent this flow of drugs that is coming to the Capital Region. As I said, none of the fentanyl is made here, none of the opioids are made here. They come from outside, often, certainly from outside this region, almost always from outside New York State, and often from outside the country. And what HIDTA has done, and it's been very successful in Albany County, which has a HIDTA, is they coordinate. The federal and locals coordinate. And the feds can say, oh, there's this huge shipment of fentanyl coming from this gang that often deals with a gang here in Albany or drug traffickers here in Albany. Be on the lookout. We need the HIDTA for Schenectady and Rensselaer counties. Our law enforcement know that we need all hands on deck. And without them, the numbers just get worse. So New York's HIDTA program has provided millions of dollars to the Capital Region and other upstate areas, law enforcement, and the Albany Sheriff and the Albany Police Department will tell you how good it is. Well, we need to expand that to Schenectady and, whoops, did I do something? Nope, okay. We need to expand it. Oh, your light went off, that's what happened. There you go, I knew something happened. We need to expand it to Rensselaer and Schenectady counties. Drug intelligence officers gather and share information and work with the HIDA officials, and they are much more effective at preventing drugs from coming here. They arrange funding for Naloxone, which, as you know, can prevent drug overdoses and save lives, and manpower to coordinate the initiatives. So Naloxone can quite literally help reverse an overdose if it gets there quickly enough. And the two programs I'm pushing would allow more Naloxone here. In Albany County, Naloxone was administered over 500 times. In Rensselaer County, 200. In Saratoga, 150. In Schenectady, 250. So, the bottom line, Capital Region needs both these, this two-pronged approach. One, to deal with treatment and prevention and rehabilitation. The second, to deal with preventing the flow of drugs here, to deal with law enforcement. It's sort of a 1-2 punch that we will get done. So I want to promise the people of the Capital Region I'm going to use all the clout I've got as majority leader to get this increase in funding and to see that a good share of it flows here to the Capital Region. And with that, let me call on Keith Stack, who has done a great, great job here in Albany. And I think he's going to bring up somebody who's had is receiving treatment ACA to speak about her experience. Keith. Great.
I want to thank Senator Schumer, Majority Leader Schumer, for coming today. We really appreciate your visit here and the message that you carry. Also want to acknowledge Sonia Frederick, the Common Council member from the 1st Ward. Senator, you've graciously acknowledged our wonderful staff, and they truly are wonderful. We have many here, and we also have a number of our clients here with us today. I want to acknowledge two board members, Mary Ann Klein and Tony Gorman, ACCA board members.
Thank you.
I mean, you identified the problem perfectly, and it was exacerbated by the COVID epidemic. But yeah, overdoses and deaths from overdoses are on the rise. You know, we seem to have been making some headway prior to 2020, but just the isolation forced by COVID created real problems. And again, illicit fentanyl is today's problem and is really driving the opioid epidemic. We provide all of the services that this funding will go to. We provide prevention, school-based and community-based. We provide outpatient residential services and recovery services. So ACCA will definitely benefit from this new funding. Recovery is life-changing. It has been for me. And we have a resident here who's been very, very successful, Alicia and her son, who you met. Two or three? Two, okay. Jason, Alicia is going to come up and speak.
Thank you, Alicia.
Yeah.
You don't mind being on camera, right?
No, are you going to be on camera with me?
Yes, I will be on camera with you. In fact, if we stay close together, we'll take a picture for everybody. Because you are courageous and strong to do this and help others. Okay?
Yes.
Thank you, Alicia. And Jace. Hi, you little cutie.
Yeah, ACCA is definitely gave me another chance to rebuild my life, not only with me, but for my kids. The staff is great. The house is great. Beautiful programs. They really help you if you really want it. I've been here a couple times, but it wasn't the program, it was me. But I've learned a lot now, and I'm ready to move forward. I'm moving to the next step tomorrow.
Nice.
I'm a little scared, but I'm also happy to get on with my life and with my son and my other children. So.
Thank you. Well said. And you know, let me just say this to you, Alicia. So, you know, when something terrible happens to you, the human reaction is to get angry, fold in on yourself, to go to treatment, and then to have the courage to talk about it here is very, very biblical. In the Bible, they say you're lighting a candle. So thank you for doing that.
Thank you.
Thank you. Thank you. Okay. You finished, Keith?
Yes, I am. I think you may be open for questions. Yes.
Okay. We'll take questions on this subject. Folks, any questions? I hear them.
With this funding, I mean, you've mentioned that there's a lack of facilities that provide these services in the area. Specifically with the Schenectady overdose, there's a lack of methadone clinics in the area. Would this funding go towards providing, you know,
Yes.
a bit of relief for that shortage?
The program, some of the money goes directly to programs like ACCA, but a lot of it goes to the state. And the state can then say, Schenectady needs a methadone center, we'll pay for that with this money. Other questions? Okay. Go ahead.
You mentioned your tie that you're wearing. What's the latest with the gun conversation?
Yeah, I've been on the phone just as recently as 15 minutes ago with Chris Murphy, who's been leading the fight here. And the Democrats and Republicans are working very, very closely together. I'm very hopeful that soon they will have an agreement, and as Majority Leader, I will put that agreement on the floor as soon as they have it. Okay? All right.
Another quick question I had, Climate Summit, we're about 6 months out from that. I guess if you were to give a message to activists who are looking at that and hoping for some big investments, what would that be? And
Yeah, look, climate, you just have to look at the weather anywhere, and particularly with all the firestorms out west, the flooding out west, Yellowstone, we just read about that, and here, that climate change is very real, and we need to do much more about it. We're working hard to get that done in a variety of different ways. It's really important, really important. And I hope the Supreme Court doesn't prevent the administration from moving forward. There's a court case that's pending now. Okay, thank you.
We just heard that the Biden administration has sent more money to Ukraine. What are you and your colleagues hearing about the war in Ukraine and about the progression of events?
Well, look, the Ukrainians have shown amazing strength. And most people thought Russia would roll over Ukraine in a week or two, and clearly that hasn't happened. They're not asking for American soldiers. They're asking for the equipment and the armaments they need. And there's broad, broad support in the Congress and the country to give that to them. Last one from one other hand. Yes, sir.
On the footnote 563, loophole, is there any movement?
What's that?
It's to curb inflation. I know Senator Cantwell had mentioned it, as well as
Yes.
Taco and
It's about, yes. So we want to, I mean, there are only 4 oil companies, and their costs of bringing the oil out of the ground have not increased, but what they're charging people has gone way up. So Cantwell has a proposal which I support, which would go after that, and we're trying to move that to the floor of the Senate. Okay? Thank you, everybody. Have a great day. I'm on my way to Green County. Thank you.
Mr. Ward.
Thank you.
You're welcome.
Thank you very much. Thank you. No.